Hello, everybody, and welcome to another episode of the Better Brain Fitness Podcast. My name is Tommy Wood, and I am joined as ever by my skeptical co-host, Dr. Josh Turkner. I was going to call you stimulating, but I changed it at the last minute.
I like
Say
that.
hello, Josh. Yeah.
I don't think we've used that one. At least not that I can recall.
No, I don't think so either. And so we have a question, and that word relates to the nature of the question, if not the topic. But it's something we can dive into probably over at least 2 episodes to kind of really get into it. And it's something that I think everybody will be interested in.
Right.
So we have a question from Sebastian, who lives near Canterbury in England. And he says, I've been wondering exactly what are the effects of caffeine on the brain. Because last night at about 11:30 in the evening, I had a cup of coffee, probably my 6th of the day, and half an hour later, I was sleeping the sleep of the dead and the just. So given that the most commonly reported effect of caffeine, that it keeps you up at night, doesn't seem to be happening to me, how can I trust anything that people say about it? Cheers. And obviously that's a very important British sign off. All right, Josh, a super interesting question. Why don't you kick us off and we'll see where it goes.
All right. Thank you, Sebastian. He's becoming our resident British gadfly. I like it. Always a skeptical take. So I'm going to start by tackling. So there's kind of 2 questions that he has. The first is just what are the effects of caffeine on the brain? And then the second has to do with how can you trust information that contradicts your own personal experience. So beginning with the first question, what is the effect of caffeine on the brain? I'm going to talk about, I think we'll focus today on kind of the short-term effects of caffeine. And then because there's also the longer-term effects of caffeine that are also super interesting, but probably deserve their own dedicated time. So we'll focus on short-term effects. That's kind of what Sebastian was referring to in his question. The effects of caffeine come from the fact that they block adenosine receptors on cell membranes. So adenosine is a chemical that builds up in the brain over the course of the day. The longer you're awake, the more it builds up. And it's a breakdown product of ATP, which is the energy molecule in the brains that we use to generate energy. So as the day progresses, adenosine builds up. It binds to receptors on neurons throughout the brain that are involved with promoting wakefulness. So in multiple different circuits. So it blocks the activity of the neurons that keep us awake when it binds to those receptors. So the more adenosine that's around in the brain, the sleepier we get. And caffeine blocks those receptors so that adenosine can't bind to them, which means there's less inhibition of those wakefulness promoting neurons. So we get this temporary surge of alertness. And then once the caffeine is metabolized, it's no longer blocking those receptors, then adenosine can bind again. And since it's kind of built up while the caffeine was blocking those receptors, it may result in a sudden increase in sleepiness when the caffeine wears off. So the effects of caffeine on alertness are zero-sum in that way. So the bump that we do get, we have to pay back later on. So we trade a little bit of alertness now for a bit of extra sleepiness later, unless we then just keep consuming caffeine to negate that effect. There are some other effects, again, thought to be mediated as well through the adenosine block. So one is kind of indirect facilitation of dopamine and norepinephrine signaling. So you can get some mood boosting effects from it, mild elevations in heart rate and blood pressure. There's also, you get some improvements in attention and reaction time. It has a diuretic effect that most people are familiar with because it prevents the resorption of sodium in the kidneys. It causes mild bronchodilation or expansion of the bronchi in the lungs. And it can also cause a bit of vasoconstriction in the cerebral blood vessels, which is thought to be the mechanism by which it helps for migraine headaches. when taken for relief. So those are kind of the main short-term effects. There is variability in how it affects different people in the short term. Some of that variability is related to genetics. Some of it is related to lifestyle and other factors. So the genetic ones are related to polymorphisms in the adenosine receptor and in the liver enzyme that breaks down caffeine. So the polymorphisms being just genetic variations that result in a different form of the protein. So different forms of the adenosine receptor could cause variations in the effect of caffeine. So some people that may mean it results in some it's more anxiety promoting. It may also impact how stimulating it is. And then by the same token, the polymorphisms in the liver enzyme that breaks down caffeine can change how long or short the caffeine lasts. So if you break it down really fast, then the effects are fairly short-lived. If it's slow, then it's going to be much longer-lived. But the average response is alertness, then followed by some mild sleepiness. But various combinations of those polymorphisms can result in a range of different effects depending on the person. So some people can get a brief stimulant effect and then a fast crash, depending on their genetics. And even in a minority, those polymorphisms can even produce a kind of a calming effect, similar to like Ritalin or other stimulants in the context of ADHD. So potentially that calming effect of a busy mind could actually help someone to fall asleep. So those are kind of genetic factors that cause some variability. And then also lifestyle factors make a difference, including your caffeine consumption habits. And what Sebastian describes is a recognized phenomenon, most commonly seen in people who are habitual and heavier drinkers of caffeine. He did mention it was his sixth cup of the day, and that may be possibly a habit. So in that circumstance, if the brain is seeing caffeine all the time, it's going to try to restore equilibrium in the adenosine subsystem by doing things like upregulating the number of receptors. And that's kind of the primary mechanism by which you get tolerance to things like caffeine or anything that's consumed chronically. So the more, and if you upregulate receptors, now you need more caffeine to achieve the same effect you had with fewer. And as I mentioned, caffeine crashes or rebound fatigue after the caffeine wears off is a known phenomenon because of that buildup of adenosine that in a habitual drinker, because of the upregulation of the adenosine system, that effect can be enhanced even further. So you might see a greater crash. You also can have scenarios where if you've been chronically sleep deprived and have been compensating with caffeine, you kind of ultimately hit this point of maximum tolerance and you cross this threshold, so you crash and then sleep really hard. So the key point with all of that is that the context makes a big difference. Yes, the most common effect is this increase in alertness and a reduction in sleepiness, but the context makes a big difference. There's also another additional nuance, which is it's also likely that the quality of sleep is impacted in this case. So when people are saying that caffeine impairs sleep, it's not just saying that it'll prevent you from falling asleep, but also that it can alter sleep quality. So even if it didn't, increase your level of alertness, the research indicates that it likely still altered sleep architecture in some way, and most commonly reducing the time spent in deep sleep. So I would say in this particular case that his experience didn't necessarily contradict the science, but rather kind of represents an edge case. But it does illustrate that the effects of caffeine are much more nuanced than how they're often, commonly presented We also don't know if what he experienced was because of or in spite of the caffeine that he consumed. So it's possible he could have eaten a sugary meal and been crashing, and his caffeine tolerance meant that the caffeine was little match for the sugar crash. Um, but that's not to say that this sort of thing doesn't happen all the time, where somebody's personal experience seems to contradict what the science and the experts tell you. Sometimes that's because the nuances have been glossed over and it's presented as more black and white than it is. And I'm going to come back to that topic in a minute and maybe rant for a second. But first, I'll I'll ask Tommy if you got any thoughts, comments on effects of caffeine on the brain, and and Sebastian's question.
Yeah, this is a very nice overview, and I've got a few things to add. I think so. What's most interesting, or one of the things that's very interesting to me, is the effect of caffeine on cognitive function acutely, particularly in people who are habitual consumers. So
Mhm.
there's a reasonable amount of evidence now that when you have your first cup of coffee in the morning as a habitual coffee drinker or tea drinker, or however you consume your caffeine, you feel an immediate boost. And as you mentioned, increasing dopamine signaling, noradrenaline signaling, you get some improvements in mood. Some of that is due to the pharmacological effects of caffeine, but some is also documented in various different studies, just the placebo effect. And so, like, you're going to really look forward to this cup of coffee in the morning, and then, as you engage in that process, you get a boost. But another effect, so like of like at least three different things going on at the same time, is that you are overcoming a relative deficit in cognitive function due to the lack of caffeine in your system that your body is expecting, because it has adapted accordingly. So often when people feel better, they feel like their brain is functioning better, is because they've like hit that button for the thing that their brain needs,
Right.
because they've developed some kind of dependence, or at least they've adapted to it such that their brain expects it. So multiple different things happening at the same time, which is super interesting. And I say this as, I'm one of those people where, like, I wake up in the morning and I'm just like so excited to make my cup of coffee. Um,
100%.
it's interesting now that there are these well, like lots of different supplements now, whether it's like an 8-hour time release caffeine. So you like take your caffeine pill the night before, and then like when you wake up in the morning, it's like ready to go. That just seems like that seems crazy to me. Like, why would you even play that game? Because these
Right.
um yes, you can do time release pretty well now, but you never know when that's going to kick in. But also, I
Yeah.
think you're kind of stealing some of the joy that potentially comes from some of these hot beverages if they're part of like a morning routine. And this is something that also annoys me about a lot of like focus, quote unquote, focus supplements, which is basically they just throw a massive chunk of caffeine in there, and it's all
Right.
caffeine driven, and everything else is just essentially expensive filler for most of them. So those are some of the acute effects, particularly in the morning in habitual caffeine consumers. One other thing that I think is worth thinking about is how cognitive function is affected across broad domains. So you mentioned like your focus improves, reaction time improves, certainly, but there's also a fair amount of evidence to suggest that in more complex cognitive tasks that require, like difficult working memory tasks, like an n back, like a 3 back, where you get a sequence of numbers or letters, and you have to remember whether the number or letter that's popping up now is the same one that you saw like 3 numbers or letters ago, which is actually, it's a very difficult working memory
Yeah.
task. People who, even habitual caffeine consumers, when they consume caffeine, it can actually impair very complex cognitive tasks like that. So reaction time improves, you're more alert, your arousal is increased, but actually it can impair some more complex cognitive functions. And the same is the same is seen for other stimulants when they're not used in the setting of ADHD. So like methylphenidate for example, in people who don't have ADHD, it has the same effect. So you can overstimulate the system and you feel great and you think your brain is performing well. But actually, if you look at sort of detailed function in very complex tasks, you've probably gone too far over the arousal curve and your brain just isn't able to retain information in the same way. So that's not good or bad. It's just worth knowing that sometimes there's a disconnect between how we think we're performing and how we're actually performing. And this is actually also relevant to the sleep, to the sleep question. So when it comes to that, sleep question, one thing that's interesting about, again, the acute effects of caffeine is that they may be most pronounced and most beneficial in the setting of sleep deprivation. So when you look at studies where people are sleep deprived over long periods of time, either an individual, like a single dose of caffeine, or regular smaller doses of caffeine, like 50 milligrams taken every 2 or 3 hours, can help to sustain cognitive function as sleep deprivation continues. And one of the reasons it's thought that that's the case is because as you become sleep deprived, certain dopamine receptors are downregulated in the brain, and caffeine can help to offset some of that. So, particularly in the setting of sleep deprivation, caffeine may help you retain cognitive function. Whereas if you're well slept and then you like throw a bunch of caffeine on top of that system, you may actually, it's common to overdo it, even if we don't realize it, for at least for complex cognitive functions. So when you then get to caffeine and sleep, there's a couple of interesting papers that I think are worth mentioning. So both done by the same group. The first was a meta-analysis done a couple of years ago. This is by a group mainly in Australia, but also some of the group are in the UK. And they did a meta-analysis of caffeine intake and then the effect on sleep. And what they found essentially was that the bigger the caffeine dose, the further away it needs to be from sleep to not impact it, which is pretty obvious. But they estimated that for around 100 milligrams of caffeine, which is an average-ish cup of coffee, if you consumed it 8 or 9 hours before bed, it probably wasn't going to have an impact on your sleep. A lower amount, like 50 milligrams, like you might get in a cup of tea, you could probably consume within a few hours of bed and it wouldn't have any effect. But if you have like a big fat whopping dose, and they talked about like a pre-workout stimulant you would take before a workout, which can often have several hundred milligrams of caffeine, you probably need to consume that the day before for it to not have an effect, at least in some people. So then they did a very interesting study as like a follow-up, where they took individuals, and it was all men, unfortunately, but they took a group of men and they had them take caffeine in multiple different doses and different timings. So 100 milligrams or 400 milligrams. 400 milligrams is a big dose in one go for most people. 100 milligrams, maybe like a cup of coffee-ish. And then they had them consume that 4, 8, and 12 hours before bed. They also had placebo conditions, and they had like a washout day to day. And then they measured their sleep. So they had this, it wasn't like a proper polysomnography, but they basically had an electrode across the forehead so they could kind of measure sleep stages, certainly better than if you were trying to do it with a wearable like an Oura or a Whoop. This is definitely much closer to the real thing. And then they asked them how they thought they slept. And this kind of comes partly to Sebastian's question. So what they found was that if you took 400 milligrams of caffeine, whether it was 12 hours, 8 hours, or 4 hours before bed, all of those impacted sleep. And so if you're going to consume a boatload of caffeine, at least as a one-off, it basically has to be first thing in the morning. Then the 100 milligrams was probably not having much of an effect at 12 hours or 8 hours. And actually it looked pretty much the same as the placebo group across most timings. Maybe like 4 hours, there was a slight effect. But in reality, they basically said that if you're having 100 milligrams, you could have it within 4 hours and it's probably not going to affect your sleep at all. Now, what's interesting is that in the 400 milligram group, even though they were being affected, on polysomnography 12 hours or 8 hours before bed, they only felt that their sleep had been negatively impacted when they took it 4 hours before bed. So there is and this is seen in several studies. There's a disconnect between how well we really slept and how well we think we slept. So this could be playing a role in Sebastian's experience, like you kind of alluded to, which is that you think you're sleeping well, and yes, technically you are asleep, but you might not be sleeping as well. You might have a little bit less sleep efficiency, so less of the time in bed is actually asleep, and you're more likely to spend time in light sleep rather than deep sleep. And you don't know that because you're asleep. So I think all of those can play a role in thinking about how caffeine affects the brain in the short term. I think that was everything that I had for the short term question. So, Josh, I'll throw it back to you now for your little rant about
Yeah.
The second part of the question.
All right. Well, before I get to that, I'll follow up on a couple things you said.
Great.
So I noticed that somebody hearted when you said that the drinking a regular cup of coffee 4 hours before bedtime didn't seem to have an effect. I agree. That's a bit of good news. By the way, if you're enjoying our episode, feel free to hit the like button. Apparently, that drives it up in the algorithm. So,
Oh yeah, nice plug.
yeah, thanks. And then I was thinking also earlier when you were talking about that first cup of coffee of the day. You've seen people who would say, oh, you should wait 30 minutes to an hour because you're not there's no adenosine to block right when you first waking up, so you're going to get more of an effect, which mechanistically is true, but I think that the effects that we experience are probably more related to conditioning, right, that like you said, than they are related to the adenosine. So that would explain why we still get that boost of from that first cup, even if our adenosine isn't super high at that point in time. Thank you all for the likes, people. Took that to heart. Appreciate it. And then the other thing too was you talking about the effects of caffeine on sleep and how we're able to reconcile that with with the data that we have on its positive impact on things like Alzheimer's prevention and so forth. So we'll tee that up for the next episode, but that is an interesting, those two things, the role that we know of sleep in dementia and how caffeine affects that, and yet the data that we have on long-term effects of caffeine. All right. So
can I follow up on your follow up before you go into the last little bit? So just to mention that, and we can put this in the show notes, but there was a very nice sort of summary review paper recently came out looking at some of the sort of myths and misconceptions around caffeine, and we've sort of mentioned a couple of them that I think are worth bringing up here. So one is that caffeine is dehydrating, and you're right, caffeine does have a slight diuretic effect, but for most people, the increase in urine output that creates a slight dehydrating effect is offset by the liquid that you consume that caffeine in. So it's just worth saying, like, everybody says that caffeine is dehydrating, but as long as you're not popping caffeine tablets, the net effect on your hydration status is probably minimal, unless it's, again, like very high doses with not enough sort of relative liquid to come with it. And then the other one was that you should delay coffee for some period of time to have an effect. And again, they sort of went through that, and there's basically no evidence to support that. And like you said, I think it's because many of the effects of that first hit of caffeine are unrelated to adenosine, and they're related to habituation and placebo and a whole bunch of other things that sort of come from that. So we'll find that paper and link to it. It was quite a nice overview.
Cool, great, yeah. Okay, so permission to rant?
Absolutely, go for it.
Okay, so the second part of Sebastian, I wanted to call him Simon. Sebastian's question is about how do you believe things when from an expert, when it contradicts your personal experience. So in his case, sleeping really well after a cup of coffee at night. And this raises the issue of kind of what I think about, and which comes up a lot in our conversations, of kind of universal and contextual things about health and biology. So there are certain facts about health and biology that apply to everyone. Everyone needs water. Cyanide is lethal for everybody. Botulinum toxin will cause paralysis in everybody. And then there are other things that are specific or contextual, where the impact is going to be contingent upon any number of factors like age, genetics, gender, coexisting medical issues, medications, life history. It's why so many of our answers start with "it depends," right? Um, and it's for these reasons that, as a physician, no two patients are really ever exactly alike. And the perfect encapsulation of this happened to me one day, and I was in clinic, and I saw two women with epilepsy back to back. And I'd started them both recently on the same exact medication. I won't name what it was. And the first woman came in and saying, "This is the best medicine I've ever taken. I've had no seizures, no side effects." She's like, "Why wasn't this the first one I was on? Everybody should be on it." Was her take on it. And then the very next person I saw, the one I saw, started her on the same medicine. She was also with epilepsy. She'd had a very negative, adverse psychological reaction to it. Uncommon, but it happens. And literally said to me, "You should never prescribe that medicine to anyone." and so back to back polar opposite experiences of the same drug. And, both of them kind of assumed that their experience was universal,
Mhm.
which is pretty common. And in many ways, I think the job of a clinician is to understand all of these different contextual dependencies, which you can really only do through experience working with loads of people. And it's something you don't really fully appreciate till you've been there. When I was in my first year of neurology residency, up to that point, I'd gotten an undergrad degree in cognitive neuroscience. I'd been through medical school. I'd done a year of internship in internal medicine. And I thought I knew some things about the brain. And even like the other interns would defer to me about neuro questions. And then I started my neuro residency and was, seeing tons of cases, and I realized I had no clue what I was talking about all that time. I knew just enough to be dangerous. So, the reading the books and papers really only gets you so far. You can learn about general principles, but it doesn't prepare you for working with people. And I think in a lot of cases, it can just make you a little bit dangerous because it gives you the illusion of knowledge and maybe the perception that things are more uniform and predictable than they are. Working with people is extremely humbling in that way. And so experience is the best teacher. And I bring it up because there are a couple scenarios where I think this is really applicable today. One is where you have lots of people on podcasts and social media giving advice and making claims that are very black and white. And I think one of the giveaways when I'm listening that someone doesn't work with people or has limited experience is that they don't appreciate the universal and the contextual and tend to talk in absolutes. Sometimes that's just because they don't know what they don't know, like me before I'd started my neuro residency. And other times is, deliberately eliminating the nuance because they know that gets more attention. And the marketplace doesn't reward nuance, and that's a problem. And one of the main forces that creates so much health misinformation today. And then another place it applies is in health guidelines and protocols. And in public health, I think there's been a general strategy to remove some nuance and present things as more black and white as whenever possible. We talked about this a little bit in our last episode about statins, where there are recommendations that at the population level will result in a net benefit. So what that means, for example, if you were to have a hypothetical drug for, let's say, psoriasis, and you test it in 100 people, and 20 people are cured, 10 people get a little bit worse, and it has no effect in the rest, and 70 of them. So if you say everyone with psoriasis should be prescribed a drug, then the net effect is going to be positive, right? Even though 1 in 10 will be harmed a bit because 1 in 5 are going to be cured. But then what happens if you have some clinicians who say, wait a minute, I can actually predict who's going to be helped and who's going to be harmed by the medicine. So I'm only going to prescribe it for those who will be helped. And I have this other, treatment approach I found that works better for those where it doesn't. And that's kind of based on clinical experience. And then you have, governing bodies saying, no, just stick to the guidelines. You can't use that experience to guide your decision making. And that sort of thing has been, a very common scenario over the past few decades with the push for evidence-based medicine. So for decades, in medicine, clinicians relied almost entirely on personal experience to guide their treatment decisions. And that resulted in all manner of, dubious practices. So, so then we started saying, well, let's gather evidence for our treatments. And that's overall a great idea. So, we started testing treatments with controlled studies, with the gold standard being the randomized controlled trial. With the basic idea that that's the only way we can really know if something truly works. But I think the pendulum has swung really far in the other direction now and really left very little room for clinical experience. And the problem is that there's, as we talk about so much nuance in real life for so many treatment decisions. There's no way you can have a randomized controlled trial for every scenario that you encounter. So they're great for kind of things that are universal truths, but oftentimes can be misleading or even harmful for ones that are more contextual if you have this kind of one size fits all approach. And I think this is why there's a lot of tension right now and a lot of distrust of mainstream medicine because of some of the kind of blanket one size fits all recommendations that may help some but harm others. And there hasn't been kind of a real acknowledgement of that issue. And that's opened the door for a large and growing kind of secondary marketplace to capitalize on that distrust. So if you are opportunistic, all you have to do is say, hey, was your experience different from what the experts told you? And say that's, that it's because the experts are peddling BS. So, for example, did you try counting calories or low fat and then you went keto or low carb and you lost weight and you're in better health, um, and that despite what the experts said about it, then you can weaponize that, right, to say you should never trust the experts or institutions, and even better, you should only trust me, right? And so that's how we've found ourselves in a world where people will trust a random dude on TikTok with no formal education or experience more than experts or institutions, which isn't necessarily logical, but you can understand kind of how that happens. Um, and part of this is just a failure to appreciate kind of the role of context, and the difference between kind of the universal truths and specific ones. So back to Sebastian's question, how do you trust anything? I think first is realizing that so many things depend on context, so that if you hear something that contradicts your experience, as was the case with in his case, it just may be that what's being described doesn't apply to you because there's some missing context. Um, and also consider the source. So, if you hear someone talking about matters of health in absolute black and white terms, then be wary. The people that I go to and trust most on different topics are those who have, extensive knowledge and background, along with lots of experience working with people, putting that knowledge into action. Tommy is a great example of one of those sources for me, an MD PhD, so has it from both ends of the spectrum. It's why someone like an Andy Galpin is a great source of information. Why his stuff is so good, because it comes from a mix of academic background, but also lots of work with athletes. So to me, those are the ideal sources of information. If you had to choose between a PhD in exercise science with no experience working with people versus a coach who's trained 5 Olympic gold medalists but doesn't know the difference between aerobic and anaerobic metabolism, you should choose the coach. But best case is to have both. But coaches have the real world experience to know the role of context. So in general, the more people reward people who are providing nuanced information with their attention, I think the better the quality of information that we are going to get. All right, that's my rant, Tommy. Anything to add or contend?
Yeah, I think this is super important, and it will come up probably again and again, and we may revisit this idea because there is a big difference between population effects and individual effects, and we, in general, very commonly can conflate those things. And I think it's a relatively rare group of people who are able to truly sort that out, and it like you said, it all comes from just experience working with people. So when this thing came around about caffeine, delaying caffeine intake, I think that came from one or two individuals that certainly had significant credentials, as well as that was part of their personal experience, and that then gets projected out and taken as rote. But often, when I see those kinds of things come out, I think exactly the same thing. There are people who are incredibly well read and know the literature incredibly well, but they have never sat down with a person who's like, I need you to help me, and what you said didn't work, or it made me worse. And so I only spent 2 years being a doctor. So this is not coming from my experience as a physician, but I've spent well over a decade as a coach in various different fields. And so my experience is slightly different from yours, but essentially the takeaways are exactly the same. You have to get to a point where the answer is it depends, because there's so many times when you go in, you're like, this is the answer. And then the person turns around and is like, hey, doc, you were just wrong. This was bad. I feel worse, or it didn't work. And then you have to change the framework to allow all these different variables to come into context. So I know we are both, big fans of population studies, randomized controlled trials, where because they do have huge benefit, but there's something that comes from seeing those ideas, like this thing that worked in this trial or this study, failing in somebody, and then having to rework how you think about the problem, and that just only comes from time, like sitting with other people and trying to either help them or be their doctor or whatever. So that I think is what makes it most interesting, but makes it also very tricky to then have a 5-minute podcast to answer a question about
Right.
coffee, which is now 45 minutes long. So yeah, I think this is one of the
It's
reasons
just
why
part
you and I
one.
enjoy it. Pardon?
It's just part one.
And this is only part one. So yeah, I think that we enjoy that. I think the nuance is incredibly important, but it makes communicating these ideas a lot trickier. So then you can kind of see some of the opposite happening at the same time.
Yep. Yeah. Well said. Somebody mentioned in the comments asking about whether you wear wired earbuds due to concerns about wireless waves close to your brain. I don't think that was the reason, but we might that could be a topic for another episode.
We'll cover that in another episode. The short answer is actually no. That's not the reason why I have them. I think it's something that's interesting, that's worth discussing, and we can get into it. But I have the wired headphones for two reasons. One is because, like, having AirPods and always having to charge them and stuff, I just find it's a massive pain in the butt. And second of all, I don't enjoy the feeling of noise cancellation. It feels very strange to me. So I prefer an old school style headphone. And I think especially if you're wearing a noise cancelling headphones all day, there's some evidence that it may affect auditory processing in the brain. Although I'm not going to say that like definitively, but people are starting to look into that idea. But personally, I just don't enjoy it. It feels odd to me. So those are the two reasons why.
That's good. Yeah, that's worthwhile research, considering that we're probably going to continue to spend more and more time with stuff stuck in our ears.
Exactly. Yeah.
Okay. Well, I think we'll wrap it up there. Again, we'll do a part 2 where we'll cover kind of the longer term effects of caffeine, which are also very interesting. And if you guys have any questions about this topic, anything else, you can leave it on our Substack. You can comment here, or you can also go to brainjo.academy/questions and leave a question there. That's also where you can leave it by voice if you want to, like Sebastian did. Okay, I think that's all for now. Anything else, Tommy?
No, that's it. This is great. Thanks so much for everybody who joined live, and thanks for everybody listening afterwards. And we'll see you soon.
All right. Take care.